Hi, my name is Mary Beth Peak. I'm the Director of Programming and Planning for the Greater Cleveland Regional Transit Authority. In my role here, I look for new ways for us to provide transportation services and adapt to the community and our changing transportation needs.
Hi, I'm Jose Feliciano Jr., and I'm the Manager of External Affairs for the Greater Cleveland Regional Transit Authority. And in my role, which predominantly deals with relationship management, there's a specific focus in terms of seeking out those opportunities for partnership and collaboration so that we can help move our community forward.
As a planner for RTA, we know that jobs and people are not always located closely. Therefore, the transportation needs are to put people where jobs are, and sometimes those are across the counties. The Paradox Prize provides us an experimental way to look at transportation in a unique manner to create and help get people to jobs with RTA and public transit. It also allows people to get to training and other family needs, creating public transit as a lifelong way of mobility.
And we think that our particular Paradox Prize pilot offers the opportunity for us to further seek out other organizations that we can collaborate with in terms of trying to address their workforce development needs, and in turn we can reach different populations of the county that their transportation needs are not being met otherwise.
And in this Paradox Prize, we are partnering with the Centers for Families and Children, providing transportation, navigation, and other services to people in job training programs, getting them to job training and then to work. And also the other family needs that they have, getting to doctors, getting to appointments, getting to fun. This will allow us to meet that ever-changing need for transportation and make public transit more functional and a better alternative for population within the county.
The Centers is one of the oldest and largest health and human service organizations in Northeast Ohio. We provide integrated behavioral health, primary care, early learning, and workforce services to more than 20,000 people in our community each year. In our workforce program, we work to reduce barriers for our clients so that they can find a meaningful career path, not just a job, but a true career pathway. Our workforce clients face a number of barriers, but transportation is one of the largest. Cleveland remains a very car-dependent city, making it difficult for many job seekers to reach facilities where the jobs are. We're finding that jobs and better starting wages are increasingly in the suburbs, making transportation an even greater barrier. In fact, 80% of those we serve in our workforce program do not own cars and rely on public transportation. Transportation barriers only compound additional barriers for low-income, entry-level workers and job seekers, such as access to childcare. We're grateful for the support of the Paradox Prize as we continue our work eliminating barriers for those who need it most in our community. The pilot will help us better understand how low-income workers and job seekers need or use transportation assistance to obtain a job, retain a job, or increase earnings. We'll work with our workforce clients, our funders like Cuyahoga County, and a network of partner employers like RTA and Sway Mobility to inform the development of a new coordinated transportation network specifically for low-income job seekers. Based on the information we learn, this pilot will test additional supports we can create aimed at reducing this transportation barrier. We're looking at testing a new shuttle service, advocating the expansion of TANF rules for transportation support, special fares, new routes, and eliminating barriers to access electric car shared vehicles. This pilot will help to create lasting impact for those we serve and low-income job seekers in our community. We look forward to sharing what we learn and expanding innovative approaches to reducing barriers low-income job seekers face each and every day.